Good afternoon, everyone. My name is Brian Grimkowski. I'm one of the Assistant Directors of Graduate Admissions here at William Paterson University. I want to thank all of you for taking time out of your schedule on this very warm day to join us for our webinar about our Doctor of Nursing Practice program. I'm joined here by Dr. Kem Louie, who is the Program Director, and she's going to be speaking at length about our program and provide a lot of information that we certainly hope you'll find helpful. This format is something that I think works for a lot of people. Obviously, this time of year is busy. There are work schedules. There are family obligations. It's not always easy to come to campus. It's not always easy to attend an event here. So it's our hope that you can find a convenient way to get the information that you need and learn more about our program. And certainly, it's our hope that it's a good fit for you. Also, wanted to let you know it's an exciting day for us and a very busy day for us because it's our commencement here for our graduate class of 2017 this evening. So there's a lot been going on campus. Our faculty have been quite busy and are getting ready for the ceremony, but we're certainly very excited to be able to share more information about the program for you. Just a few quick housekeeping issues before we get started. I wanted to make sure you know that we are going to be making this PowerPoint presentation available in its entirety for download. On the GoToWebinar screen at the bottom, you'll see a Handouts tab, and that'll be available for you in just a couple moments if you did wanted to download this in order to be able to refer back. The other thing is we are going to be recording this presentation and we will be making it available on our YouTube channel. So if you have to leave a little early for any reason, if you join us a little bit late and you miss a slide or two, that will ensure that you're able to go back and review it if you need to, or if there's any information that you need, that's provided here at a later time. So just know that as well. It allows you to be hands-free to just focus on the presentation and not be jotting down notes. So that should come to you by email next week, so keep that in mind as well. But I'm sure you're not here to listen to me talk. I'm sure you're much more interested in what Dr. Louie has to say about her program. So with that,
well, welcome to the DNP Information Seminar. My name is Kem Louie. I've been the Director of the Graduate Programs at William Paterson University. We have a master's degree program and most recently a Doctor of Nursing Practice degree program. So we'll start with the slides. I think in the next 20 minutes or so, maybe a half hour, I want to talk about what I will cover, and basically if you've been thinking about this degree or wondering about this degree or possibly maybe in a degree program, I want to talk a little bit about the purpose of the DNP degree, the history and the formation of this degree. Nationally, nurses have spent a lot of time talking about this. Do we need it? Why we need it? And those things. Also, there are external factors which led to the creation of the DNP degree. There are benefits of the DNP degree, and I think this is something I think we in academia and those that have graduated need to continue to talk about what this is because it's still new and it's only 10 years old, I mean, as far as a degree is concerned. There are standards. They're referred to as the DNP Essentials, which I'll talk about. You'll see them in the slides also. And of course, I can't not talk about our program here at William Paterson. We'll talk a little bit. I'll share with you some admission requirements and what the curriculum, so that if you've been thinking about it or currently in a program, it varies somewhat from program to program. Okay, so I'm going to move on. These were the objectives that I just discussed. Sorry, I didn't move the slides. Okay, so what is the DNP? The Doctor of Nursing Practice degree is the highest, what we refer to as the highest clinical practice degree that any nurse can achieve. So it is a doctoral degree. It's different from a PhD degree, which is primarily most, as myself, you saw that I had a PhD, research-oriented, looking at the nursing science. This is a translation of the evidence into practice, clinical practice. DNP programs prepare nurses with scientific knowledge, and also there's a practicum that's expected within this particular degree. And the focus is looking at where we are in a healthcare system, looking at quality, looking at financial costs, the whole decrease in costs really, in addition to what they refer to as quality patient outcomes. This, for some of you already in school, maybe heard the term, it's referred to as the triple aim. The DNP program different from a PhD is to look at achieving the triple aim. And it's not just nurses who are looking at it. It's also many other practitioners. Now, we've had clinical doctorates in the past, and they've had a variety of initials. But this is just something for some of you history buffs that in 1960, which is probably older than some of you on the webinar, Boston University opened its first what they refer to as the clinical doctorate. And then historically, Case Western Reserve, maybe some of you may be familiar with that university, I believe it's in Ohio, had the first what they call ND, was a nurse doctorate program. And then as you can see there, that's the University of Texas, I believe, opened what they call a DNSC, which was really a combination of a PhD looking at more clinical issues, the DNSC. And then Kentucky, University of Kentucky opened its first DNP program in 2001. But they opened it up when they were still discussing it. The AACN, I should have written this out, is the American Association of Colleges in Nursing. It's another nursing program which many of the academic institutions, baccalaureate as well as higher degree, master's, doctorate programs, belong to this organization, and they're the ones that promulgate standards for the degree, particularly the DNP degree. And then as you can look through there, the final standards were approved in 2006. So we look at 2006 as the initiation of the DNP degree. So that's when I had mentioned that in 2017, the actual degree is, 11 years old now, and so it's very, very young. And there's different forms as different universities have looked at this and sort of held to the standards, but at the same time made the degree more applicable to the particular community, locale, and state. Now, the DNP program across the United States have been growing, and this is just a slide that looks at the DNP degree, which is your upper part of the slide, and then your research focus. There was a major concern that when the clinical doctorate degree began, that the research focus, the PhD programs would sort of decrease. And we could see from this particular slide that's not true. We still do need PhD degree programs. I have more later numbers. As of 2014, there are 269 programs, DNP programs. And as far as the PhD programs, as of 2014, there's 134. Obviously, the growth of PhD programs are a little bit slower, but the DNP programs have really taken off. Part of this, and I think I'll move to the next slide, is that when the DNP program was conceived, created, initiated, it was believed that it was mandatory. That by 2015, I think it was DNP in 2015, that all advanced practice, nurse practitioners, clinical specialists, midwives, and nurse anesthetist programs should have this practice doctorate by 2015. Well, partly I think because of the growth of the program, there were some regulatory issues in some states. Some of it just wasn't feasible if nurse practitioners were able to earn a master's degree in primary care health for the population. Certain legislators felt, why would they spend the extra money to care for population? So there were a lot of issues. So the actual mandatory DNP in 2015 was withdrawn. So I think the initial growth is because some of the nurses felt, well, if this was mandatory, I better do it now kind of thing. But it may be in the future, but right now I think to move the profession, I think it's very difficult to make something mandatory. But by 2020, the nurse anesthetist organization, all of nurse anesthetists must have a DNP by 2020. So that one organization as advanced practice groups have gone forth. So nurse anesthetist students who are going in must enter a doctoral program. Okay, so you could just see the growth, and again, this is data from the American Association of Colleges in Nursing. You could see the difference of enrollment and graduations. Again, it's just what you're looking at is an increase in the numbers. All right. Now, so why are we talking about the DNP? How did this come to be? As you can see from the growth before, from the various programs that had thought that this is a good thing, and it still is a very good thing. I'm very committed and very passionate about this particular degree, and I'll probably share it with you. But the impetus towards the DNP degree, there was an increase in knowledge in nursing practice. As you know, some of you are have finished nursing programs. We kept adding more content and more because the healthcare system is changing. Patient care regulations, complexity, thresholds, outcomes are increasing. There's been a national focus on quality and safety. Obviously, we have more nurses than ever, and yet the hours seem to still be there. So what's going on? We've also increased education among nursing and other professionals. Preparation of leaders is very important. And I think some of you who have a master's degree and even as a baccalaureate degree, you graduate as a generalist. You've got some leadership issues when you go into nursing master's program. You get more leadership issues, but even as you'll see in one of the essentials, leadership organizations also is very highly stressed within the DNP degree. There was also a shortage of faculty, nurse faculty, leaders in practice, as well as nurse researchers. Okay. Continuing with some of the external factors. External nursing, the IOM, which is the Institute of Medicine, when they publish reports, all the reports are evidence-based. They don't publish anything, so that's why some of these reports take 2 to 3 years to come out. But so we do rely on these IOM reports, and some of you have done papers, I'm sure, have cited the IOM. Also in 1999, another report was kind of older, but somewhat still pertinent today. The title is To Err is Human, focused on the fact that our healthcare delivery system is not seamless. Patients can't seem to move from acute care into maintenance and then rehab. It's fragmented. It's broken in parts. We have different institutions. I think the larger health systems are trying to make it a little bit more seamless or user-friendly. Also, not soon after, in 2001, the IOM report, Crossing the Quality Chasm, looked at and recommended that we look at the healthcare and the complexity of the healthcare system. And as nurses, we know this very well. It's very frustrating for patients to get certain kinds of needs, and then why can't an organization or a healthcare system move this patient and their records through seamlessly so that they can get a continuum of healthcare. And then again, the IOM report talked about the fact that we need educators to prepare health providers for this new type of practice. There's been a focus on interdisciplinary teams, again, evidence-based practice, quality improvement, in addition to informatics with the electronic health record. Even in the nursing education, I don't know, I remember when I was a master's student many decades ago, I think I graduated more than 60 hours, credit hours. But I believe if some of you are in master's program or thinking about master's program, it's very rare that you're going to see master's program beyond 50. I know our family nurse practitioner program currently is 48 credits, but in order to have the courses and the clinical practicum that is necessary, the competencies to take care of patients in primary care setting with prescriptive practice in many of the states. So that was increasing. In some programs, the clinicals kept increasing. So you could see that within the last 10 years, or let's say 20 years, 10 years is since the DNP was created, that there were a lot of things going within the healthcare systems outside of nursing in addition to what was going on nursing education. And of course, like I mentioned before, that in undergraduate masters, we kept adding more content. What about this? What about policy? Risk management had to be added. More evaluation and evidence, particularly the research component, needed to be added if we base our practice on evidence-based. So a lot of things were going on at the same time, and that's what some of the reasons that sort of drove to this new degree called the Doctor of Nursing Practice, which focuses on evidence, application of evidence. So the point that the DNP is that it's for advanced practice nursing or advanced nursing practice. There's a difference between AP and is to look at what's happening out there in the healthcare system. We do have educators in our program, and I'll talk a little bit about that when we get to our curriculum. Not all programs will accept nurse educators, and there are different, what they call now, tracks within the DNP. But let's look at what an advanced nursing practice, which was broadly defined by the American Association of Colleges in Nursing as any form of nursing intervention that influence healthcare outcomes for individuals or populations. Of course, they can be direct care as an NP, can be management, someone who's a manager can also be considered advanced nurse, is part of advanced nursing practice, administration, healthcare organization, as well as implementation of health policy. Health informatics is also considered a part of nursing practice. What you're seeing here is you don't see nurse educators. Okay, and I'll talk a little bit about the understanding of that. Now, there are some benefits, I guess you might say, okay, so if I were to come, or I'm in a program, or thinking about it, what would be some of the benefits if I graduated from the DNP program? Well, you would be earning advanced, what we call competencies, in particularly understanding, looking at the healthcare delivery system. I think many nurse practitioners should come back to our program because we have a postmaster's program. We don't have a BSN to a DNP, but they realize they're very competent, they're working with patients, they're certified, they see the patient in front of them. Part of the DNP in a course we refer to as population health and epidemiology is to look beyond the patient, that we have a lot of chronic diseases, but I think the DNP nurse needs to say, okay, where's all this? What can I, within a community, look at and say, okay, these are chronic health issues, but some of the diabetes really can, I guess, be prevented unless there's a genetic component to that. But maybe more health education, and maybe if we're doing health education, why is the health education not very effective? All right, so there are advanced competencies in practice. There are some DNP programs where we feel that at the doctoral level, because of the faculty shortage, and the reason the faculty shortage could, to me, continue to exist is some of us that are faculty are getting older. And it's a different role. So we believe that the DNP nurse would have competencies if they've taken some education courses. Another benefit of the DNP is that the knowledge that you have from some of the research or evidence-based practice courses, you're there to improve practice and patient outcomes. I think you think it, but we give you the skills, actually part of your DNP project, or the way the projects, we used to call it a dissertation because we were in the first programs at our university, and we want to make sure we use language that many of the other academic departments understood. But in the last clarifying issues of the DNP document, were not to use the term dissertation, but the rigor of the project, so we call it a DNP project. In some universities, they call it sort of the capstone. But the AACN says that the project must be some form of intervention. You have to do something with it, which may either show some quality outcomes in practice, or where you're, what I had referred to earlier about the triple aim. You must show that whatever intervention you may evaluate or design save some money, consumers money. There is a lot of waste, and we know that. Also, one of the benefits, the term is enhanced leadership skills. You may obviously be a leader by your position in your institution, or hoping to move in the system with some management or administration positions. But we talk, there is one of the standards or essentials, look at organizations and systems. And in our university DNP program, I happen to be lucky to teach the leadership. We look at chaos theory, that sometimes every day can be chaos, but there's supposed to be some sense of what is it, not calm. Once you understand some of the definitions and terms in chaos theory, it sort of makes sense. It takes a while to sit on you. But another benefit is the educational credential for those that require advanced practice knowledge. So the fact that you have these letters behind your name shows, and again, like I said, it's only 10 years old. Enhance ability to attract individuals to nursing from non-nursing backgrounds. We believe, and I think many of you as nurses have worked with nurses that have come from another background. It could be from the humanities, it could be from the social sciences, and say, you know, I've always thought of wanting to be a nurse, and it enhances who they are and what we can give to the patients as well as to nursing practice. One of the other benefits, as I've mentioned before, is that we believe that the DNP, if you've taken additional education courses in your program or taken additional education courses, that you can teach. That would be another role that one can apply for with a DNP degree. Not all universities hire DNP because it is a practice doctorate, but there are other universities that will hire you in a tenured positions. All right, you've heard me say several times about the standards. These exactly are the standards promulgated from AACN. And I'll just go over them, but this is how it's listed, that in the DNP program, there are further theories that are being utilized to understand practice. They may come from the social sciences, they may come from leadership, they may come from obviously psychology, pharmacology, medicine, genetics. So we do touch on other theories of health behavior, the health belief model. Some of you may be familiar with that. We focus some of that particular theory when some of our students conduct a DNP project using sort of a theoretical model, sort of the umbrella. We talk about as another essential organization and systems leadership. And again, it's not just studying leadership for leadership's sake or leadership theory. The whole point of systems leadership, and I mentioned earlier about chaos there, is for quality improvement and systems thinking. From the leadership point of view, an example might be the culture of safety. That now I believe, sure, in your institutions, that when an error is made, a root cause analysis must be instituted. We don't say, oh, you did that and we're going to punish you or put you. And that's not the way we want to look at it. We want to look at maybe there's something in the system that needs to be reviewed, corrected. The nurse, again, medication error seems to be one of the largest types of safety issues among the profession of nursing for a variety of reasons, as we know. Another standard, or they call it essentials, is clinical scholarship. How do we begin to take the evidence and then translate it and apply it to practice? There's a lot of evidence. A lot of PhD nurses have been developing some knowledge, but it doesn't sort of get translated to the practice arena. And that's where primarily I believe the DNP nurse has a major role with her degree. Informatics or information systems technology has boomed, as you well know, and that is something that we talk about in one of our essential courses. How to utilize that data, how to evaluate that data, how to collect that data, and what does that data mean? It's what we call the big data. Healthcare advocacy for healthcare, looking at some of the changes legislatively, politically, for the populations that we care for, and the nurses' role. I know that nurses are our patients' advocate, but the complexity of some of the policy issues and for the populations that we care for, we need to know how to do that. Interprofessional collaboration for improving patient and population health outcomes. I know that as nurses, even from the baccalaureate together, we work with many disciplines. But in this particular, it's not just working with them. I think with social workers and obviously medicine, pharmacists, and many other disciplines, rehab, communication, speech pathology, that it's how do we as nurses begin to build that team. And sometimes the teams that are created depends on the needs of the various patients and groups that we care for? Where do you begin? And nurses, do they usually take the lead on that team, looking at some leadership competencies, kind of thing. Another essential or standard is looking at what we call clinical prevention and population health. This looks at the epidemiology, which is the science of data for population health, incident rates, prevalence rates, mortality rates, just to name a few. But to look at some of those, the data for our region or community and say, hey, there's something going on. We're seeing some health deficits here. Maybe we need to be proactive and look at that. So that includes global health. It's a course I teach, which is really, to me, exciting. We talk about, because it's locally, what happens in the world affects us. And I think a good situation was several years ago with the Ebola. And so we cannot just close our borders off and say we don't know what's going on with the health of other countries, because it does affect us in some way. All right, and the last essential or standard is what they call advanced practice nursing, which it really encompasses practice competencies. We do, or the DNP program degree requires that you have theory didactic courses in addition to what they refer to as clinical. All right, so basically I've kind of gone over what is essential in ingredients, and I think if you look at DNP programs, many of our courses address these specific essentials. I call them DNP core courses. Now let me move on to the next slide, which talks a bit about our program. As I mentioned earlier, we are a postmaster's DNP program. We began our curriculum, and we've got final approval from the state and everybody in 2011, our first cohort. We graduated 11 students. And again, being the first course, I mean, we had the curriculum, we had the courses, we had the faculty. So there are programs in our state that have a BSN to a DNP, and within that BSN DNP, you don't get a master's, but some of what was referred to as the master's courses, particularly if you're involved in advanced practice, you would have the advanced patho, the advanced health assessment, the advanced pharmacology, which we refer to in NP programs as the 3 Ps. That would be at the doctoral level. So you would be getting your DNP with either one of the NP as one role of advanced practice. So in our program, you must have a master's to come into our curriculum. And again, the focus is on practice at what they call the aggregate or group level, system or organization level. We do accept nurse educators because I believe, I straddle both. I have the sort of the education as well as the advanced practice as a clinical specialist, that I think the educators also can contribute to the triple aim, which is, again, improving quality outcomes, decreasing financial costs or cost savings, and looking at the quality of patient care. So we do have nurse educators in our program, but their DNP project must look at the practice of nursing. Their project cannot look at looking at courses of nursing students, because that's not the intent of this degree. Yes, there are issues in the generation of students, but that's not the DNP. That's not the purpose. So we do allow nurse educators. All right, let's just look at some of the requirements. Again, it's a lot. Obviously, you can come to our website at the www.wpunj.edu, and I usually just go to the search function and put DNP. Our application for the next fall cohort is June 1st, so I'm not really sure if those of you on the line are saying, oh, I've barely been thinking about it and I just want to see what your program is about. But the deadline for all the materials is June 1st. You can email me or speak to me if you have been thinking about it, or apply we take one cohort at a time, and we only start in the fall. Our class sizes tend to be on the smaller side, so believe me, I do meet with you every other Saturday. I'll talk to you a little bit about the program, but let me just finish the admission requirements since you're looking at it. As I said, we're a postmaster's, meaning you need a master's degree in nursing. It can be in nursing education or administration or in any AAPN specialty. Of course, you need a B average, but we want you to be slightly above a B average. And you can read this, registered nurse license. We believe strongly that because this is a practice degree, you need experience. So we say a minimum of 1 year. So some nurses I know go through the baccalaureate and then into the master's, and they haven't had much work experience because many of our students, and one of the philosophy in our program is that many of our nurses, they speak to each other. I mean, they have, in the sense that they share their kinds of experience and reflect on those experiences. We have nurses that have 15 or more, and we have some of the DNP students a little bit younger, and they have a year experience. So I do believe very strongly that we need to help each other, that the younger nurses listen to the older experiences, and but those with more experience need to guide and mentor some of the ones that have just come out of school, maybe with a minimum of 1 year work experience. If you have your advanced practice certification, we'd like to make sure that it's current, so you need a copy of that. This is an important aspect. It should have been bulleted, but verification of number of supervised clinical hours in your MSN programs. One of the requirements of the DNP degree anywhere is that you must have earned a minimum of 1,000 clinical hours. Now, where do you earn that hours? Well, we take into consideration, as most programs do, the number of hours that you earned in your MSN program. Now, obviously, if you're an FMP and you graduated because you're across the lifespan in regards to your clinical experience, then you would have a lot more hours than someone probably as a nurse administrator or nurse educator. So if you earn like 100 hours in your Master's of Education program, we would consider those hours. If you had, I think our FNP program is 680 hours, we would consider the 680 hours. But you cannot earn your degree unless you have earned 1,000 hours, because this is a clinical doctorate. So it is important that we have the associated hours post-baccalaureate. Of course, you had clinical in your baccalaureate degree, but we don't take that in consideration. It's the hours that you have in your master's program. And then we have 4 clinical courses where you can earn additional hours to meet the DNP competencies or meet the DNP essentials, which looks at economics, which looks at finance, which looks at leadership, which looks at clinical issues, culture of safety. So it's really meeting those competencies. So those are additional hours, and some just make the 1,000 hours, some go a little bit over the 1,000, but you have to have 1,000 hours. You may have finished all your coursework, you have a wonderful DNP project, but if you don't have the hours, you're not going to get the diploma. We do require 3 letters of recommendation, and the recommendation are either from colleagues or a former faculty, which looks at critical thinking, your commitment. It's a difficult program, I'm not going to kid you, but you do come out changed. You need to look at your life and balance your career, look at your support system. And we've graduated, as of today, we've graduated 4 cohorts, and we do have support services here on campus. Another admission requirement is an essay. We want to hear from you. Why the DNP? What do you hope to achieve? What do you think you would like to do? The typical question is, what do you want to do in 5 years from now with this degree? And again, the DNP, the Doctor of Nursing Practice, is a degree. What seems to confuse or is not clear when I talk to people, which is fine, is that it's a role. It's not a role in the sense of a nurse practitioner is a role. You have prescribed responsibilities. It's a degree, and within that degree, there are probably many roles. So I just wanted to mention that. It may not, some of you may have thought of it. Some may say, well, I don't know. It is a degree that you earn. We do ask that you submit a resume or a curriculum vitae, which is a more of expanded resume. Particularly, we would like to see that you're sort of not only where you worked, obviously, but did you, when you finished your master's degree, or if you had a capstone or a thesis, did you share that thesis? Have you published? Are you on committees? Are you invested into this nursing profession? It doesn't mean that if you have it and you're relatively young, but you may be a member of 2 or 3 organizations, nursing organizations. That's fine. Also, some applicants, depending on some of their career goals, or may have an interview. It's just so that we can get to know you a little better. And usually when we have the interview, this is a wonderful time to meet some of the DNP faculty that we have. You may have questions. I know I get questions all the time. Well, I don't know when is the right time to start. Well, like anything else, I'm not sure there's any one right time to start to go back to school for any degree, but I know that there are times when it's not right, and that's particularly if you're taking care of aging parents or relatives, if you have children that are under 5, I always say 3, but you know, the balancing act is very, very difficult. Let me just move on. And you could look at that slide again. As Brian said, you probably can download them. They're also all over our website. Full-time students can complete what I call the DNP core and clinical course. It's really in 2.5. If you just keep moving and successfully pass the courses, depending on the previous master program, of course, you must earn 1,000 hours. As I said before, if you don't have that number of hours, and you need to, what I call, earn independent hours. We have hours within the clinical, and then we have hours, experiences that are outside the clinical, and I call them independent because I didn't want to confuse them. Our program is 41 credits in total as far as credit hours. We do have part-time plans, but I'll talk about that a little bit later. At the university, we allow 6 years to complete, so it's a can-do, as you can see. Most of the 4 cohorts that have graduated actually finished at the three-year mark, because part of it is the data collection, and some of them, the students, needed a few more hours. We have what we call a hybrid program, which means we're not totally online. Our master's program also is not totally online. Our faculty likes to sit and meet with you. Not to say there's anything wrong with it online. We do have some online courses. The way that we have configured it for the students that come to our program is that you take 2 courses or 6 credits every semester, which is fall, summer, spring, and fall. So we have a 3-semester in our academic semester. So at the end of 1 year, you have 18 credits. That makes you a full-time student. All right, and as a full-time student, if some of you have been full-time, you would be eligible for other types of financial aid. So our model is that 1 course, let's say in the fall semester with our new cohort, they're going to take 1 course online, okay, and then the other course, and depending on the nature of that course, we meet every other Saturday. Usually it's in the morning. For a 3-credit course, it's 9 to 11:30. And this is the opportunity to maybe do some online assignments, but when we meet, we talk and we discuss. We further think about the issues, or if it's a particular core course or an assignment. So that seems to work. I don't take attendance. You're a doctoral student. Obviously, some of you are very, very busy and have commitments, either traveling, committees. So obviously, I think as doctoral students, and you would think too, that you would get the information or share it. I think a year ago, the class just wanted to be together. They would FaceTime each other. They would hold up the cell phone, and the other person, whether they were out of the state or something, would participate in that way. I mean, that's how they wanted to do. I didn't mind at all. So I thought that was kind of Interesting. That was commitment. Again, the DNP curriculum at William Paterson, as in most programs, cover the 8 essentials. And rather than read this, because I think it's ABC, we talk a little bit about the epidemiology. We have statistic courses. I give a workshop on writing for publication, evidence-based practice. We don't have pathophysiology as such if we develop the BSN to DNP. I mean, we have it, but we're not offering a BSN to DNP. We obviously include pathophysiology. Leadership issues, you've heard that already from the essentials, policy issues. We talk about, obviously, ethics. We do have within the curriculum not only the essentials, but there are what we call 2 electives. And it is within those 2 electives where you would enhance your DNP project. We don't have tracks. If you looked at other DNP programs, you have what they call, originally they called them a direct track, which is clinical practice, or an indirect track, which is your administration, informatics. We have felt as a faculty that the essentials are being met, and that's how we accept educators, although their project must focus in the clinical practice, not on the learning for nursing students. So the components basically are your curriculum, your electives, and then your practice project. Okay, let me just move to the next slide because there's more. In your clinical, and you can say, well, what else do I need to know? Well, as a DNP, there are DNP competencies, which are subsets of the essentials that you're seeing in the slides. And I'm trying to think of an example, but I can't off the top of my head for some reason. But you are to part of the experience of developing the project, of which your clinical is closely tied in, is we had somebody that graduated in one of our earlier cohorts, was very interested in the financial aspects and how many of us really understand the economics and the finances, and had spent 1 semester actually, actually the finance department at his institution, learning about the language and how our insurance and costs bundled and that kind of thing. And actually his project was a financial aspect, looking at costs of patient care. So in the finance department, obviously, there's not a DNP expert. I mean, I would venture to guess in our finance department, we wouldn't have nurses there. But found, I believe he was the head of the finance department, was very eager to share this information with anyone who would be interested. So the expert on his dissertation was somebody, I believe, from the finance department, or finance was part of his project. In our clinical placements, again, it said it depends on the current student expert. Actually, I have a student now who's very vested in the elderly in our community, and her electives has to do more. She took a course in geriatrics, actually from a medical school, as one of her electives, and one of her committee members is somebody from Paterson, who works with the elderly in one of the elderly housing projects in Paterson. So you could see sort of the relationship between the projects, the clinical, and this particular student's experience. So DNP students, I'm on F now, may choose from a variety of settings and systems depending on their interest. And what I usually when we talk about their project, because I think, oh, you come in, do you have an idea? Well, some have an idea, some not sure. And I always try to say, well, tell me what you're interested in doing. What's your passion? Where's the bulk of your experience been? Because then you have an intuition about what might be needed as a doctoral student to improve the healthcare system, outcomes, and quality care. So, let's see, where am I now? All right, again, the 1,000 hours, we have to say that. I know some of our DNP students have attended this national DNP conference, and when I ask them how they enjoyed the conference, they say, oh yeah, everybody has to do the 1,000 hours. I said, yes, it is a requirement for the degree. Again, this is sort of a slide that just sort of lists all the courses. And you can see from some of the titles, if you remember some of the essentials, the clinical health promotion, health policy, information systems, scientific foundations, these are the essentials that have to be met. Leadership and collaboration. The 7400 is evidence-based. It's more research and looking at evidence-based practice. Cognates are just sort of a fancy term for electives. I think it's an old-fashioned term, but when we created it, we called it a cognate. And you could see from the practice project that we assist you in that capstone project. There's a class, and then you have a particular faculty in nursing who will work with you or mentor you with it. You're not sort of expected to come up with this wonderful, grand, rigorous project on your own. You have a nursing faculty mentor. And the fact that we started the degree in 2011 and now it's 2017, our faculty have had about 6 years to feel more confident. We do have DNP faculty. They also act as mentors too. So, and sometimes I will confer with one of our DNP faculty because sometimes I'm not exactly sure. But I know that it's in the practice domain and where the project has to take place. And then you see the last 2 courses, well actually there are 4 courses, which are the practicums, where you identify certain areas in the DNP essentials that you need to meet. And the student is expected to find an expert, a preceptor. According to the DNP document, it's preferred if there was a DNP preceptor available, but I believe right now, since the degree is 10 years old, we have many experts that have not gone on for their DNP, but I would say because of their years of experience and where they are, it is quite acceptable to have a preceptor in the clinical that does not have a DNP as of yet, because the degree is still relatively new. I'll go on to the next slide. That's my information, my direct phone number, my program assistant, Elaine, her email. She knows a lot about the DNP, the graduate admissions. Oh, that's the middle one, sorry. The graduate at WPU nj.edu. That's graduate admission. That's where Brian. And so I'm going to move on and turn it over to Brian. If there are some questions that you may have, I can clarify that for you or add to it in real time. Brian? Supposed to...
Thank you very much, Dr. Louie. If anyone has any questions, you can go ahead and type them in the chat box that's there right at the bottom of the GoToWebinar screen. Also want to just reiterate 2 points. First, if you joined us a bit late, maybe you missed a couple of the earlier slides, you should be able to download the presentation below under the Handouts tab on the GoToWebinar screen. And also, I want to make sure you know we are going to be sharing this presentation in its entirety on our YouTube channel, and we will be emailing that to all of you as well. So same thing, if you jumped in a little bit late, if you missed any of the slides, if you need to refer back to anything you saw here during the presentation, you'll have the opportunity to view that at your convenience further down the line. So just wanted to make sure you knew about that. We have had a couple questions that have come through while we've been talking, so I'm just going to go and I'll turn them right over to you, Dr. Louie, if that's all right. Yep. One question you touched upon cost, and I know that's a concern for anybody who's considering a graduate program. Can you talk a little bit about if there are any scholarships that are available for prospective DNP candidates?
Yes. Thank you, Brian. Yes, that is a frequent question. I mean, particularly, there are some institutions, I understand that even though this is sort of what we call the terminal degree, this is sort of the end degree for nursing before, until the DNP degree came in. The fact that we accept a full-time student cohort, you would be eligible to apply, obviously, for financial aid. Generally, financial aid would be federal loans. There is a special program that I've had for almost 14 years. It's called the Nurse Faculty Loan. And the monies really are pretty scant as far as the nation is concerned. But the nurse faculty loan the purpose is to increase qualified nurse faculty to teach in nursing schools. I had mentioned earlier there are many, I think some of you may know that some of your faculty are very old, have been in the business a long time, and because of the baby boomer generation will be retiring probably in the next 10 years or so. So there's been incentive from the government to say, hey, if you go into this role, what we'll do is we'll give you, lend you money. The government actually gives me, William Paterson, and other schools, it's called the NFLP, where you will pay for your tuition and educational costs for the time that you are a DNP, but you will have to take some education courses, obviously, and then when you graduate with your DNP degree, you need to find a full-time nurse faculty position in a nursing school. It has to be an RN program, not an LPN program. And for every year that you are employed full-time, you get a certain percentage of what you borrowed, what they call forgiven or canceled. So up to 5 years, you can have 85% of what you borrowed or needed for your DNP degree canceled. Now, there are some people who say, you know, I really would want to teach. I love teaching, but, you know, after 3 years, I'm moving out of state, or, you know, I want to try on a different role. So then you would have had 3 years of loan cancellation. It's a percentage. So, I mean, I'll just give you all the information because this is exactly the same program anywhere else if they have an NFLP loan forgiving program. At the end of the first year, you can't, the government will cancel 20%. At the end of the second year, you work full-time as a nurse faculty, 20%. Third year, 20%. At the end of the fourth year, 25% is canceled. So in total, if you work 5 years as a nurse faculty, 85% of what you borrowed is forgiven or canceled. All right, it's not a bad deal. Something that just came through in this new award period, I will not know if I have monies until July 1st. I did apply. I did ask for 5 doctoral student tuition. Is that there may not be a full-time position, but if you have 2 part-time positions, that's equivalent to a full-time position, and I will have to kind of figure out if you graduate and you have and you're working full-time, but you're still teaching at 2 different places, but you know I have to make sure that it's equivalent to a full-time, and then the loan cancellation. We do not have to personally. William Paterson has to hire you. Oh, no. There are positions. Sometimes they're not in your backyard. You may have to travel a little bit. Again, associate, baccalaureate programs, even an RM to BSN, it has to be a full-time position to be eligible. So as far as that's the only scholarship, some individual colleges may have specific donations from various alumni and say, well, we have this amount of money that can be applied for. But as far as William Paterson, we do have some funds, but it's really for general nursing students, which you can apply for at the university. Is there another question, Brian?
Yes. A student asked, what type of clinicals are we supposed to choose?
What types of clinical are you supposed to choose in the DNP program? I suspect. They're clinicals based on the DNP essentials. I know here, based on the essentials, the 8 essentials, there are sub-objectives or competencies. And I have the student look at that, and some of the competencies are met because of the course, like the leadership course. There are some leadership kinds of competencies, but then there are practice kinds of competence in developing an interprofessional team. So you might say, gee, you know, that's something I really, it's important to me. So then you look at those objectives, and then you either find a placement, and again, you can't be paid. It has to be on your time, obviously. So you'd have to kind of figure out finding a mentor that can provide that kind of experience. I know it's kind of general because I think your question is a bit general. You could email me if you're being a little bit more specific. I'm not sure if I'm really answering, but the type of clinical is based on meeting the DNP competencies, which I have a list that I always give out to students when they're starting their first course.
Thank you very much. And then I believe you touched on this a little bit, but a student was inquiring if they are able to attend part-time for the program?
Oh, yes. We are graduating actually today a part-time cohort. What happens is, I mentioned earlier in our curriculum, to be full-time, because we go summer, spring, and fall, that's 18 credits. So 18 credits, or if we were just in 2 academic semesters, it would be 9 and 9. We think that's too much, because I know many of the nurses that come to our program, they're working full-time because many of them are using tuition reimbursement from their institution. So taking 9 credits, a full-time student, full-time worker, you're burning the candles at both ends. Very, very difficult. So this particular part-time cohort that is graduating actually today is taking 1 course a semester. They take 1 course in the fall, 1 course in spring, 1 course in the summer, then they do it all over again. I said, if you're a full-time student with the 41 credits and the 1,000 hours, you can accomplish that in 2.5 years. Most of our students, like I said, it's been 3 years. With the part-time cohort, it's been just about 4 years, maybe 4 years and a semester, 4.5 years. So until I get a cohort, meaning that if I have, let's say, not so much this fall, because I haven't had any requests, but let's say for fall of 2018, if I can get 8 students, either from the same institution, or 8 students who are saying, listen, I can't do 2 courses at one time. I know my life. I can do 1, 1, 1. Then I would consider a part-time cohort.
Thank you very much. I believe that's it for our questions as of right now. So that concludes the formal part of our presentation. Dr. Louie, I can't thank you enough for your very informative presentation. For all of those in attendance today, can't thank you enough for taking the time out of your busy schedule to join us for our webinar. Hope that you got all of the information that you need. Obviously, if you haven't already applied for the program, we hope to see your application in the near future. I know Dr. Louie is available as a resource. You saw her contact information before, as well as the Graduate Admissions Office, which is located in Morrison Hall. We'd be happy to see you in person anytime, get an email from you, a phone call, whatever might be helpful to help answer your questions. But again, thank you so much for joining us. You'll be getting an email from us probably next week with the link to this presentation if you need to refer back to it. And otherwise, thank you so much for your time and enjoy the rest of the beautiful day. Take care.